3ET EvacSHEET. This is the 3ET EvacSHEET. It's designed to evacuate a patient on their bed mattress from a building in an emergency. The EvacSHEET has a working load of 250 kilos. Each EvacSHEET has a washing label and its own serial number. Made from heavy-duty, flame-retardant fabric, all the straps are stored in individual pockets with poppers. Long, high-visibility pulling straps are provided at both ends of the EvacSHEET. Three long colour-coded cross straps are fitted as standard. To hold the EvacSHEET in position, heavy-duty elastics are provided at each corner. Fitting the EvacSHEET. To fit the EvacSHEET, first remove the mattress and place the EvacSHEET on a bed frame with the print facing up. Replace the mattress and secure the EvacSHEET with the elastics in each corner. When required in an emergency. When required in an emergency evacuation, remove the head and footboards from the bed frame. Pull out the bedding and swaddle the patient in the bed sheets. Ensure the arms are covered and leave the pillows in place. Reach under the mattress and remove all the EvacSHEET straps. Strap the patient in firmly until the mattress curves up around their body. When strapping, hold and push the fixed straps towards the buckle whilst pulling firmly on the top free strap, remembering to gather and tuck in all the excess strapping to remove any trip hazards. Alternative strapping. Depending upon the size and condition of the patient, other strapping options from red to red, blue to blue, green to green, and cross-strapping across the chest and across the legs are available. Smaller patients should be positioned towards the middle of the mattress and secured by crossing the red straps with the green straps before securing the middle blue strap. With a double amputee, leave the arms out and secure the top strap across the chest before securing the two other straps. Evacuating the patient and mattress. 2 persons. Lower the bed to its lowest position. If available, tilt the bed frame to raise the head end. Working together, use the full length of the pulling straps to maintain a good posture. Start short and allow the straps to pass through the hands as the mattress travels to the floor. When working with multiple persons, 3 persons. When working with multiple people, teamwork is important. One person at the patient head must take charge and coordinate the team movement. 4 persons. Slide the patient and mattress in one continuous movement well clear of the bed frame. Moving through the building. Moving through the building, both operatives pull the patient head first, taking wide turns at the corners and passing straight through fire doors, allowing them to close on the patient's legs. Whilst moving through the corridors, remember to keep checking the patient behind is not colliding with obstacles left in the corridor. When reaching the stairs, the patient will have to be turned. The pulling straps should not be wrapped around the hands. They should be held in an open hand so they can be dropped if you stumble, freeing your hands to stop you falling onto the patient. The patient must move down the stairs feet first. Moving down the stairs. Moving down the stairs, always take the patient feet first. It's important the operatives communicate with each other when working on the stairs. The operative at the foot end makes their way onto the stairs holding the pulling strap short. They hold their patient's legs up until their hips have cleared the top stair. The operative at the head end pulls back on the pulling strap as the person at the foot end lowers the patient's legs onto the stairs. Working with this technique of holding the patient's legs up until their hips pass the tipping point allows for a smooth, comfortable transition onto the stairs. With 3 operatives, position 1 at the foot and 2 at the head end. Using the same technique as the 2 operatives, transfer the patient onto the stair and move smoothly down the centre. Using the unique features of the EvacSHEET, a narrow doorway can easily be negotiated by tipping the patient onto their side slightly. Airflow mattress. The unique features of the EvacSHEET allow its use on airflow mattresses. In an emergency, remove the power pack before swaddling the patient in the bed sheet. If necessary, remove some air from the mattress so it will bend easily around the patient. The airflow mattress and patient can now be moved in the same way as a standard mattress on the 3ET EvacSHEET. 3ET EvacSHEET. Contact info@3et.co.uk.